Hi everyone, this is Lewis here from Dynamic Physical Therapy. If you've been dealing with knee pain and nothing seems to fix it, the problem might not actually be your knee. A lot of people focus all the attention on the painful area, but the knee is often the victim and not the cause. If we look at it, the knee is going to sit between the hip and the ankle, so it depends on both for proper movement. If your hips are weak, your knee might collapse inward when you're walking or when you're squatting, and if your ankles are stiff, your knee might take on all the extra stress. So instead of treating the knee, we'll look at the full chain. Improving hip strength, ankle mobility, and movement control can significantly reduce the pain in your knee. That's why exercises like squats or lunges sometimes hurt, but not because they're bad for you. It could be just because your body isn't controlling them well yet. If your knee pain keeps coming back, it might be time to look above and below the joint. And that's exactly what we do here at Dynamic Physical Therapy. A great exercise that we can do to improve the strength in your hips and the stability is using a band. So you're going to place it just above your knees. And you're going to try to face the mirror just to make sure that your alignment is correct. Tiny squat. You're going to push out into the band, so that's going to activate your glutes a little bit more, and you're just going to take steps to the side without letting that resistance win. So small steps, toes pointing forward, and you really should feel it up in your hips. You're going to go into one direction, then you're going to stop, and then go to the opposite direction in a very slow and controlled manner. Another great exercise to strengthen your knee and your hips, work on mobility in your ankle, is a lateral step down. So all you need is a step. You're gonna place one foot on the step. Gonna make sure those hips are level. You don't want to drop one hip. Stay nice and tall. Hinge a little bit at the hips. Engage your core and tap your heel and come back up. The heel is just gonna go down and up, and you want to prevent the knee from going inwards or outwards. It's going to be a very slow and controlled movement. Just tapping and coming.